Hi, my name is Jessie Smith with Medicare Giving. We're a group of independent Medicare agents who help seniors navigate the Medicare process. This video is perfect for anyone wondering when they need to sign up for Medicare and how to do that. We're going to be going over things like an initial enrollment period, special enrollment period, how you enroll, and making sure you avoid penalties. Let's start out with the initial enrollment period. Your initial enrollment period, or IEP, is a 7-month window when you're first eligible to sign up for Medicare. It begins 3 months before you turn 65, the month you turn 65, and then goes until 3 months after you turn 65. For example, if your birthday is in April, your initial enrollment period begins January 1st and goes all the way through the end of July. If you're already taking Social Security benefits, you're going to be enrolled in Medicare automatically. Social Security will mail you a small red, white, and blue paper Medicare card that'll have your Medicare number on it. It'll show that your Parts A and B will begin on the first of the month that you turn 65. If your birthday is on the first of the month, it'll show the first of the month before you turn 65. Now, if you have employer coverage still and you don't want to take Parts A and B quite yet, you can contact the Social Security Administration and ask them to delay that start date for you. If you're not taking your Social Security benefits yet and you're wanting to sign up for Medicare in your initial enrollment period, then you'll need to go to ssa.gov/Medicare to apply. You can see in this chart, if you apply within the 3 months before you turn 65, then your Parts A and B will be effective the first of the month that you turn 65. As you can see in the second chart, if you enroll in Medicare Parts A and B in the second half of your initial enrollment period, you're not going to get a penalty, but there will be a delay in the start of your effective date. We always suggest people to reach out to us 3 or 4 months before they turn 65 to make sure they get this process started and their coverage can start the month that they turn 65. If you're working past 65 and you still have coverage from your employer, then you're going to use a special enrollment period when you do retire and go on Medicare. Now, to qualify for a special enrollment period, the insurance you're coming off of needs to be based on current employment. Things like COBRA or a retiree health plan don't count as current employment, so if that is your situation, you want to sign up for Medicare in your initial enrollment period. If you're using a special enrollment period, there'll be a form for your employer to fill out in order to prove that you've been on health insurance up until that point, and you'll avoid the Part B late penalty. The general enrollment period is a safety net, but it's one that we want to avoid. This is for people who didn't sign up during their initial enrollment period and don't qualify for a special enrollment period. The general enrollment period goes from January 1st to March 31st, but coverage doesn't start until July 1st, and you will face late penalties if this is the case. Like I said, be sure to reach out to us a few months before you turn 65 or you're retiring to avoid needing to use this general enrollment period. If you don't sign up for Parts A and B during your initial enrollment period and you don't qualify for a special enrollment period, then you will face a lifetime penalty. There's a 10% penalty per 12-month period that you could have had Part B and you didn't sign up. And that penalty is added to your Part B premium for the rest of your life. There's also a penalty if you don't sign up for Part D drug coverage when you're first eligible as well. The penalty for Part D is 1% of the base beneficiary premium for each month that you didn't have credible coverage. That'll be added to your Part D premium for the rest of the time that you have drug coverage. In order to avoid those penalties, be sure to reach out a few months before you turn 65 or before you're retiring and losing that credible coverage from your employer. After you reach out, we'll help you sign up for Parts A and B, and then we'll go over all of your different options and some different quotes for you to consider. After you decide which route you want to go with, we'll help you complete those applications, you'll get all of your cards in the mail, and you'll be ready to start coverage. Each fall, Nancy or I will reach out to you to get an updated list of your prescriptions, run those against the new prescription drug plans that are coming out, and make sure that you're on the best plan for the following year. We're always here to answer your questions, inform you on important Medicare updates, and be your go-to people for all things Medicare. If you have any questions on the things I covered today, feel free to leave them in the comments or reach out to us. Be sure to check out our other videos, and we'll see you next time.